Got your pen. Sorry, what's your name again?
James.
All right, so James has had a question. Please, sir.
I was just going to ask, when we're stretching the muscle fibers, we're not stretching in the normal type of
That's right.
lengthening way.
That's right.
I just want to know kind of like if there's any, what the difference is between that. Is there any more benefit for us doing it in the different way? And also, as well, the other part B of the question was that we don't usually stretch, lengthen muscles and hold them for a prolonged period of time before exercise because we don't want to kind of like starve
Shut
them
things
or
off.
shut things off.
Yeah.
So would this method be suitable for pre-exercise because we're stretching in a different way?
Because I'm not dealing with the neuromuscular pathway. I am dealing purely with the soft tissue. And it's not on the feedback system. This is purely, I'm dealing with the fascial component, hydration, changing how things move within itself without involving nerves. So I'm not going there. So I can use this at any time during the routine. So if you've got someone who's not engaging properly in the way that you want, you might want to get them down and see if you can loosen up the things that are restricting them from being able to engage those various muscles, right? Also, think about if I am targeting a specific area on the tissue, then what kind of clientele would benefit from this that normal MET or PNF stretching would not be suitable for? Who do you think in your clientele base would that be? Hypermobility, so those that have lax joints, right? So anybody who overshoots their range of motion. Yeah, anybody, I agree. But it's particularly good because with MET and PNF, with someone who's hypermobile, the thing that you're stretching is their joints. And the thing that's happening there is they're already too lax. The range is already too open. So we want to get them to stretch. We want to get them to engage muscle. How can we do this? How can we get the environment we want without doing a length stretch? And this is not about lengthening something. This is why it's transverse. This is about creating movement within the tissue so that it fires. It has the ability for things to hydrate and get in there and to work. Even though I'm not directly working with the nervous system, this nervous system, the environment will change so the nervous system can now be engaged. Yes?
If you're always kind of going for that transverse approach to stretching with this technique, is there any, like just imagining, say the piriformis muscle is at the top, the way that's situated across the leg, we couldn't go in this same pathway, could we? Because then we'd be doing the normal way, so would we have to switch?
Turn over.
Is that a funny question?
Yeah, but this is sort of the things that I've spent years working out. It's like, how can I get at something across it and create a movement? So for instance, I want to get at the back. It moves way too much for me to do most techniques. And so I can do it very easily by getting in there, lock in, and rotate. But I'm using my bed as my platform. So here with the piriformis, I can come in this direction and basically use the lever. Right? So it's fantastic for really deep muscles. So because you can get very, very deep without injuring your own hands. Getting them involved.
When you say use the lever, when you piriformis?
This is my lever. Yeah. So I'm going to go in here, get my depth, take it across, and then I'm going to
okay.
Yeah. So all I'm trying to do is I'm just trying to find the direction of the fiber and just go across it. So if I'm going to work into shoulders, which is a complicated, the girdle is very complicated, well, how do I get it so that, I'm not getting this to move too much? If I can ask you just to push into my hand right there, just right there. That's it, that's shrug. That's all I want you to do, and release that, relax. So I'm going to use the assisted thumb in this case, and have you shrug, please? Good, release and relax. Shrug, release and relax, good. So I've just gone in. I've got a very shallow muscle, so I don't want to use something that locks in that manner because that's just going to squish against bone. But by me being able to come in shallow, I'm able to get the stretch that I need without being invasive. So it's very good for muscles that are not very deep. It's very good for when there's too much movement. When there is too big of a muscle, yes, and you want to get deep. Or maybe you want to get into the abdominals and do some stretching that you normally can't do. Because you don't want to go down and interfere with all the organs, but you need to go transversely. Maybe you need to go into diaphragm. Maybe you need to go into intercostals to increase the breathing muscles so that they can get more expansion and engagement. And we use breath with that, in order to do our process. But that's what it's to get things going in a safe environment without you, the therapist, actually damaging yourself.
Can you show us some discuss?
Sure.
I think it's really interesting because as you said, it's like all over the body,
Yes.
and you're only limited by your imagination. And then also,
That's right.
you with clothes on,
Anytime, anything, yeah.
and the
Just get it.
difference
No,
is
your
so
anatomy,
quick.
isn't it?
Yeah,
Really?
yes.
It's just basically
It is.
acknowledging insertion and
Yes.
moving that joint away from
Yeah,
it.
push one way, move the other.
Yeah, exactly.
First aid training.
Okay, so I'm going to look down on you. Okay, good. I want you to
You wanted to volunteer.
Okay, yeah, cool.
I'm going to actually get you to do that because that's putting you in too much extension. Okay, so I'm going to lock in, cross transversely, take a deep breath into my finger and release. Good. Into my finger and release.
Oh, so you're basically pinning and getting them to do the work, basically.
Yeah.
What, is he
His
breathing
job.
into you?
Yes, he breathes into my finger.
And you're pushing
Yeah.
down?
But I could use that in so many ways, through the diaphragm, through the chest, up the sternum, and get them to
Any breathing
actually
muscles.
breathe so I can sink like for impacts. So take a deep breath into this right one, please. Take a deep breath in there. And I'm now locked. I'm following. I'm locked. Now breathe into that you and I'm done. So I've used his breath to follow through, find out where his resistant point is, lock into it, then he breathes again, and I've stretched it in a very nice way. I do not like techniques that get in there and absolutely dig into pecs. Yeah, especially with women. I mean, this is really tender, can be very, there's nothing about being a hero. There's no hero in pain in massage. You can get things done without that.
Would you use a sliding lock? Because I really like to, you were like holding and breathing, but I'm always like wanting to.
That's a long stroke.
Lungs, isn't it?
That's a long
Lungs.
stroke, yeah, that's a long stroke. What this does is the compression and shearing actually deals with certain mechanoreceptors in the body, in the fascia. Yeah, and they love that. They love this and they get a really good response from it. Yeah.
Well, I found that when we was doing the quads, it was pretty uncomfortable on my legs when she was
Very well.
uncomfortable.
Uncomfortable. Realize that not everybody is going to do it on the ground that's really comfortable in the first place, and maybe your speed or your depth and speed is too aggressive, because I always meet into the point of comfort and where they can tolerate it, and I can get very deep, and I can go deeper, and I can go deeper, and I can go deeper. But what is my point? Yes? So all I'm going to do is I'm going to find the point of comfort. That's their range, and that's what I work with. Yes. So you might, and without me knowing what's going on, you might have been working too fast, too deep. Yeah. But there's very seldom do I ever get to the point that goes, oh, this is uncomfortable, I can't tolerate this. That's usually the therapist's technique that's not grand. I realize you haven't done this before, so I'm not expecting you to be an expert, but it's just to give you an idea of how you can play with soft tissue to enhance your performance in your climate.
When we're doing normal traditional stretching methods, we also
Yeah.
have to be careful of stretching nerves that go along the stretch.
Yes.
Is there a concern about adding pressure onto nerves? Like things, say you were doing the hamstrings or the glutes, is there a concern about putting too much pressure onto sciatic nerves with this
Absolutely.
technique?
Absolutely. So what would be your signs and symptoms that we don't go there?
Just
Hey.
pain.
Pain. Absolutely. So if you're getting referring pain, numbness, tingling, pain that they don't like, that's your contraindication.
Okay.
Yeah?
Yeah.
Yeah.
It's just really common sense, isn't it? Yeah. Okay, well, thank you very much, everybody. Have a good lunch.